Welcome back to Open Med School. The last session we have discussed about the pharmacological management of hypertension. Today we will be discussing internal medicine competency 8.18. That is incorporating patient preferences in management of hypertension. Modern hypertension management focuses on shared decision making and individualized therapy. What are the factors that influence patient preferences? One is the age of the patient, occupation, cost of drugs, the side effects of the drugs, cultural practices, and health literacy. These are some of the factors that affect the patient preferences. So we should have a shared decision making. Discuss with the patient what are the treatment options, benefit versus risk, and lifestyle modification. Adherence enhancement strategies are important. How can you make the adherence enhanced? Simplify the regimen, like once daily drugs, fixed drug combinations, educate about the disease, address misconceptions. Counseling is very important. Instead of saying that you must take this drug, you should tell this medicine will reduce your risk of stroke. Shall we start with a low dose and review? So that should be the way of counseling rather than telling the patient take this drug. As mentioned, the barriers for adherence are the cost, polypharmacy, side effects, and lack of symptoms. Because it is very difficult to convince a patient when there are no symptoms that this reduction in blood pressure is essential. So tell them that this is a silent killer. So practical considerations: respect the autonomy of the patient, avoid over-treatment of the elderly, and balance benefit versus harm. So, as a strategy, you confirm the diagnosis, stratify the risk, lifestyle modification, drug therapy, monitor and titrate. Ensure that a patient has got adherence. If once a daily drug is given, make the patient take it in such a way that they will not forget it. For example, just before brushing the teeth, or just before taking coffee, something like that, so that the patient will not forget. So, in short, lifestyle is a first line and is lifelong. Combination therapy is common, especially stage 2 hypertension with BP 160 over 100. You start with the combination therapy. ACE or ARB is preferred in CKD patients and diabetes. Patient preferences improve the adherence. Treat the patient, not just the blood pressure. So effective hypertension management requires scientific selection of the drugs, strong lifestyle counseling, and patient-centered approach. Successful hypertension treatment is not achieved by prescribing medicines alone, but by partnering with the patient to sustain a lifelong control. Stay tuned for further videos.